about the personnel file, compliance and setup, and help you understand how to get your employee files in order and be ready for your site survey with us. First of all, you're going to have two files that you're going to create for each personnel employee that you have. One is the personnel file, and the other one is your confidential or medical file. We've listed here the things that's in each one of these files, and we're going to talk about each one of those in detail. The personnel file is going to be your application, the references, job descriptions, evaluations, anything that's not health related or background screening. Those are all going to go into your confidential folder. Both of these files are going to be locked and kept confidential. But the confidential or medical file should only be accessed by either your administrator or your director of nurses. As with the personnel file, you might have someone filing in there that's a file clerk or someone else in your office that you've assigned that duty to. So let's talk about the personnel file. At the time you hire an employee, you're going to begin that personnel file. Again, we want it to be neat, consistent, and it looks the same from employee to employee. You should be able to identify and pull out information from that file, particularly during the survey. We provide you on your thumb drive a personnel file section that's got all the tabs, and it tells you exactly what needs to be behind each tab so that those personnel files can be set up in a very neat and consistent manner. And we really want you to utilize that, at least for your survey. As you've moved further down the road, if you want to change a little of that, you absolutely can. Again, remember, all the information in the personnel files is confidential, and they need to be protected against HIPAA violations. So that means they need to be locked, and they need to be limited access of who can get into those. Particularly think about protecting that information, because we have a lot of identity theft with personnel information, whether it be driver's license, social security numbers, birth dates, you know, all of those things. We've heard reports that, you know, agency employees have stolen from other employees and set up either bank accounts or credit cards or loans and so forth. So it can be pretty devastating. So you need to take that seriously to protect that information. Again, the copies of all of the forms that you're going to need to use in the personnel file are located in your thumb drive. One of the things that you should be providing your employees is an employment letter or an offer letter. And again, this just protects you so that it's in writing, what you've offered them, how they're going to be paid, how much they're going to be paid, and so forth. So again, we put it on the thumb drive, and then you just need to enter the specific information that's on there for your employees. Under Section 1 or Tab 1, we've listed all the items here that we want under that section, and we're going to talk about those in detail next. The first one is the employment application. And again, it should be completed in its entirety. It should be in ink. It is a 4-page document. The applicant needs to fill out all the sections on there. You will have a resume possibly to be attached to the application, but we still want it to be on the application as well. And the application needs to be signed and dated by the employee. There's also an interview form. Every employee that you hire or you consider to be hired for your agency should be interviewed, and we provide you with a form. The interviewer is typically the supervisor, but it might be an office manager if they're doing the initial interview for a home health aide or something of that. There can be more than one interview, but there needs to be at least one interview completed preferably by the supervisor. That's going to make the initial or make the final determination if this employee is going to be a good fit and you're going to offer them a job. Also, every employee needs to have at least 2 references in their personnel file. And remember, the reference checks is really to validate what the employee or the applicant has put on the application. The application, anything can be put on that application. They can tell you that they've worked all these fabulous places and held all these positions, but you really need to validate that so that you can ensure that they're going to meet the qualifications on the job descriptions and what your expectations to hold that position in your office is. So the applicant should give you at least 2 references, and they need to sign the reference check giving you permission to contact that person. And again, the reference check, whoever performs it needs to sign it and date it. And it can be really anyone in the office that completes this. And for the most part, when you're calling former employees, they're only going to give you dates of hire. But what's important is that you get the dates and hopefully the position that they held there. So again, you can confirm experience. And then hopefully they'll tell you whether or not they're eligible for rehire. But a lot of agencies won't tell you that. So again, try to get as much information on there as you can. But if you only get dates of employment and the position held, then that may be all that you get. That's not that uncommon. The other thing that's important that's in there is the employee emergency contact information. And again, this is important to complete and make sure it stays current in your file, in the employee's file, because if there's ever an emergency with the employee, that they're hurt on the job or they die on the job, that you have the appropriate person to contact and communicate to. Section 2, we're going to go into next. And we're going to talk about some of the reasons why you're going to have all of these items, but this is basically license and Social Security and auto insurance in this section. First of all, you want to verify that if you're hiring professional staff or even if you're providing or hiring home health aides, that you can prove that they have a current and they have a valid license to hold whatever position you're going to hire them for. If it's a professional license, you're going to make a copy of the license, and then you're actually going to go onto the state website and make sure that that license is actually valid, that it's not a fraudulent license. We see that sometimes. You can make a lot of things on the internet now. So you want to make sure that that truly is a qualified licensed person to hold that job. And you want to print off that verification offline and put it in the personnel file. Also, you should have some type of tickler system where you can keep track of these dates when they're expiring. And someone's going back on and either requesting a copy of the new license and or verifying online that the license has been renewed and it's still in good standing. So again, you're going to do this for all of your professional people, nurses, therapists, but possibly for your home health aides if they're certified. Also, your professionals, and this also includes the home health aide, should be providing you again with proof of education. That might be in the form of a diploma. It might be a copy of the nursing degree. It could be a transcript from either high school or college. Again, you're using this to validate that they do have the training and education that you require for this position. If you're not sure what you need to ask from the employee, refer to your job description under the qualification box. And that will tell you what the minimum requirements of education you have to have for that employee. And those education requirements sometimes are state specific, sometimes they're CHAP specific, sometimes they're Medicare specific. So again, be familiar with what the education requirements are. And we want you to put a copy of either a diploma, degree, transcript, certificate in the employee's file as well. Every employee that comes to work for you, you need to be able to prove that they're able to be employed in the United States. And one of those things that we use to verify that is the Social Security card. We also recommend, and in your policy, in your personnel policy that talks about hiring and screening, we also give you the website of the Social Security Department where you can go on and validate a Social Security number. Again, we see a lot of fraudulent Social Security numbers and cards that look legit, but they're not. If you have an outside payroll company that's doing your payroll, or at some point in time you may have, they will be doing this for you. But in the beginning, you're going to want to make sure that you go online and to that website and put in the name and the Social Security number and the birth date to make sure all of those items match up and that you do have a legitimate Social Security card. CPR card, if it's required for that employee to have a CPR card, and again, if you're not sure, you can look at the qualifications on your job descriptions. Usually we see any direct care staff has got to have a CPR card. Occasionally some states don't require it for their homemaker companion, but nurses, therapists, home health aides, all of those should have a CPR card. Also, the CPR cannot be an online program because they have to have a skills testing. So again, there's a lot of acceptable ones out there. Usually the Heart Association is what we normally see. And you need to, once again, just like with the license, you need to keep some type of tickler or have a system in place where you can track when these are expiring so that you can get renewed ones for the personnel file. Driver's license, again, all of your employees need to provide you with a copy of a valid driver's license. This is another form of identification that you're going to use to, along with the Social Security card, that you're going to show that the employee is able to work in the United States. Again, you want to track expiration dates on these and make sure they stay current. We also recommend that if you've got employees that are going to be driving patients, that you also do a driver's license check on them to make sure that they don't have a history of DUIs, or if it's not been revoked, or if it's not been suspended, and they're driving with a suspended license. Auto insurance, again, this is to protect your company. In the event that employees are driving to and from patients, seeing patients, and they're in an auto accident, you want to always make sure that they're covered under their insurance. Because if they don't carry auto insurance and they get into an accident, remember that travel time to and from the patient is considered work time. So if they're injured in a car accident, you could be held liable for any injuries that occur. So you want to make sure they keep a current license. Again, this is one that you need to have some type of tickler system so that you know when it's going to expire, so that you can get a current insurance. For the people that's in your office, you don't need the auto insurance. This is really for direct caregivers that's going out into the field and driving in between patients. Section 3, we're going to talk about next, the orientation checklist, and that's where you're going to also file your job descriptions, your performance evaluations, your competencies, and any other counseling or disciplinary actions that you may have on the employee. The first one that's here is your orientation checklist. Every state is going to have a little bit different requirements on that orientation checklist. So we write this so that you're in compliance with your state. All of these items need to be filled out. Preferably the trainer is going to be the supervisor. If it's a nurse or a therapist, it's going to be your director of nursing or your RN designee, alternate director of nurses. And it should be initial. Each section should be initialed at the time that the orientation took place in the office. We also provide you with an orientation checklist to be used anytime you have an employee that changes a job. And this might be more probably for office staff that may change from an office manager to a staffing coordinator or something of that magnitude. But again, this one's not going to be used as frequently, but you could have it and have a situation where you would want to. Again, it needs to be completed by an orienter. They need to sign and initial it in all of the boxes, and it needs to go in the personnel file. Every employee will be provided with at least one job description. There may be situations when you have an employee that has more than one job description. This might occur when you've got an administrator that's also acting as your director of nurses. They also may be a field nurse, and they may even be working as a home health aide. So again, for every position that the employee holds, they need to have a signed job description specifically for that job. You'll notice too that on this job description, we list who their immediate supervisor is. That individual is the one that would do their performance evaluations. And that's who they would report to. We also put on there all of their duties, their responsibilities. We talked about the qualifications. And then finally, the employee always signs and receives a copy of the job description. So there's one in the employee file and one should be given to the employee. The performance evaluations are based on the job description. Again, an employee may have more than one performance evaluation, and they may have more than one person performing those evaluations, depending on the titles that they hold. So again, look to see on the job description who should be doing that performance evaluation. Performance evaluations need to be done at 90 days after hire and start of work. So if you've employed someone and they've not started work yet, you don't want to start that 90-day clock. So if you've done a preliminary hire on an employee, say a per diem, but they haven't accepted any patient assignments or anything yet, you may want to put them on a hold so that you don't get past that 90 days and you've not done a performance evaluation, because it wouldn't be appropriate for them. But there should be, on all of your active employees, should have a 90-day evaluation, and then at least annually. Again, you would want to do performance evaluations more frequently if there's indication that the employee is not performing appropriately. One of the things that we give to you with each job description is we give you a performance evaluation that matches that job description. And we give you the ability to grade the employee from 1 to 5. And at the bottom of the performance evaluations is an area for goal setting and signatures, and those need to be completed every time there's a performance evaluation done. The employee has the right to make any comments on that evaluation and sign it. If the employee refuses to sign it because they don't agree with it, then the supervisor or whoever is giving the performance evaluation needs to note that on the evaluation. And then the signed and dated evaluation is going to be put into the employee's personnel file. This is what an example of one performance evaluation that would look for at by a registered nurse or for a registered nurse. So we would have the title of the immediate supervisor there. Again, you would grade them 1 through 5 and then you can see the gold box there and any comments, and then the acknowledgement box where everyone needs to sign it. And evaluations need to be done face-to-face. They should not be mailed to an employee and so forth. The other thing that's required for all of your employees that are touching patients, they need to have a competency completed. Okay, competency testing or checklist is so that you can verify knowledge and that you've got an employee that's able to perform the task that's listed on their job description. This is anywhere from companion homemakers, home health aides, nurses, therapists, social workers, any of those employees that, like I said, touch the patient. The RN can provide competency testing for nurses and home health aides. For PTs and PTAs, those competencies need to be signed and done by a PT. For the OT, again, needs to be done by another OT, and they can also do the OTA. Speech is a speech therapist, and a social worker has to be done by a social worker. Now, if you do not have but one PT and you need to do a competency, the PT can have the competency signed off and completed by another therapist that he or she knows, maybe that they work with at another facility or another job, and they would sign the competency, and then what you would do is just attach a copy of their license verification showing that they are indeed an active and licensed therapist to the back of that. CHAP and Medicare will allow for that during your startup phase because they know a lot of times it's difficult to get more than one therapist or more than one social worker on board to do those. The testing can be a combination. It can be verbal demonstration or talking through how they would, say, give a bath or transfer a patient, or it could be demonstration. They also it can be done on a pseudo patient, another office worker, another nurse, another home health aide, but we do not want you using mannequins, and that's part of your policy. And again, remember, competency testing needs to be completed prior to any independent assignment to a patient, and then it needs to be repeated annually at the time of their performance evaluation. So the performance evaluation may or may not be the same person that's completed the competency. And an example of that might be a nurse that is your administrator. The administrator would do, for the director of nurses, would do her performance evaluation, but unless the administrator was a nurse, an RN, they could not do the competency. It would have to be another RN that's employed by the agency or that the DON knows. So again, if you have questions on those competencies, give us a call, and Clinical, and we'll be happy to answer those questions for you. Time slips, we do provide you with time slips. That is an option of whether or not you want to use it. Patient signatures on notes for Medicare is not required, except in the case of the home health aide. The patient has to initial and or sign any notes or time slips, however you want to do that for the home health aide. Frequently we see time slips used when the note is entered into a software, but there's no way for the patient to sign the software, a tablet or a phone or whatever. So in that situation, you may want to use a time slip just to validate that the home health aide was there. This next one talks about counseling and disciplinary. Hopefully you're not going to ever be in that situation where you need to do that. However, we do provide you with a policy on how to handle that, and it goes through the disciplinary actions so that, again, you're not put in a position where you've got an employee, a disgruntled employee that's going to file, a civil suit against you for improper dismissal or disciplinary action. So again, just be familiar with the forms that you would utilize and the policy that you need to follow if you're in this situation with an employee. Section 4 talks about the required in-services. And then also be aware that a lot of states require additional state certificates or education depending on the position of the employee and whether or not some states require the administrator to have additional training. Some states require dementia training and HIV/AIDS. So you need to be familiar with your personnel policy that would outline any specific additional state education other than the mandatory ones that CHAP and CMS require. So we provide to you on your thumb drive and in your policy manual a list of all of the mandatory in-services, and then we provide you a lot of others as well. Remember, the basic policy on mandatory in-services is that all of your staff in the office are required, and your direct care employees are required to take infection control and HIPAA annually. They have to take that on hire and annually. In addition, your field staff have to attend at a minimum the Bloodborne Pathogen Medical Device Act and respiratory disorders or TB. Those are annually. So your staff in the field have 5 that they have to take every year, your office staff 2. In addition, Medicare requires that home health aides have at least 12 hours of education yearly. The reason why the agency is required to do that is your professional staff, because of their license, they're going to be doing continuing education to keep their license. But the home health aides are not, because they don't have a license. Nobody's monitoring that they're keeping up with education. So the onus falls back onto the agency. So again, you can pick from any of these additional in-services to provide the aides, but you just need to keep track and make sure that every year that they have at least 12 hours. And one other note, the HIPAA in-service actually is a 2-hour. So the employees, by doing the mandatory ones, are getting, when they get that, they're getting 7. So you need to do an additional 5 for them. Again, be aware of your states and know, what types of additional CEUs is required for your state. And we'll go over that too also when we do your site visit. But if you're not sure, if you can't find it in your policies, which is policy 4.11, give us a call in clinical and we'll reference that regulation for your state for you. Again, here's one specifically in Florida. Florida has Alzheimer's and also requires HIV/AIDS for the home health aides and companions. So any in-services that are taken, even if they're self-study, you need to put a copy of the test in their personnel file along with a completed certificate. And anybody in the office can grade these. We provide you with the answers. It's the first file in your, when you open up your thumb drive and you go to your in-service education, when you open that folder, the first one you'll see at the top is the answer key, and it has the answer key for all of the in-services that we provide you. So anybody can really grade that, and then within that in-service, when you print that in-service, you can give it to your employee as a self-study, and then they will read through the material, take the test, grade it, or take the completed test back to you. Somebody will grade it and then complete the certificate that'll go in the patient file. Again, make sure someone's tracking these either by paper, an Excel spreadsheet, or somehow in your software if you have software, so that you make sure that all of those requirements are being met every year. The I-9 form is one that we frequently see not completed correctly when we do file audits. The I-9 is a form that validates that the employee is able to work in the United States. It has to be completed on every employee that you hire, and that form is in your application packet that we provide you. When you open that form and look at that form, you have several options of documentation that you can use to qualify or to validate that the employee is able to work. Typically, the ones that we see that are used are the Social Security card and the driver's license, but you can use a passport, you can do a work visa, any of those things, but just make sure that you've identified the documents, and then below that, where you document and write in what documents you looked at, that you're filling that, the employer is completing that section that says they validated the data that was provided to them. Again, these I-9 forms are kept separate from the rest of the file. They need to be kept secure. And the reason being that is that so all of the employees' I-9s can be kept together in one file. If in the event the Homeland Security ever was to come into your office and question if you had illegals working for you, the only forms that they can have access to without a subpoena is your I-9 forms. And we have seen some agencies that have had Homeland Security come in, particularly around the border states, California, New Mexico, Texas, where, you know, they're so close to the borders and people are coming across. So again, make sure that, you know, you're completing the I-9 completely, and that if you have documents on there that you're using for the I-9, that you track those, and if they are expiring, that you get updated documents from the employee. Those are usually driver's license, work visas, passports. Again, this just continues some information and instructions about the I-9. And again, you're just documenting that the documents that the employee or applicant has given to you, as far as you can tell, looks legitimate. But one of the reasons why we tell you also to verify the Social Security card is because this is one that typically you're going to utilize to confirm and complete this I-9 form. Again, this slide just talks about CEUs and making sure that any of your, it's always a good idea for your professional staff, if they're completing CEUs, that they're providing those to you and you're making a copy and putting them into your the personnel file. Again, it just shows ongoing education, and particularly if they're taking education for a specific task that they're doing. Maybe it's taking care of a wound back, maybe it's doing IV therapy, maybe it's doing chemo, you know, any of those types of things that you know, want to show that the employees had education and training on. You know, this is a good way to show that in the employee file. Section 5, this is most all of the statements that the employee is going to sign that needs to be in the employee file. Again, they're included, all of these forms are included in your personnel file section. First of all, that they're going to sign is the confidential of protected health information. And this just says that they understand how they're going to protect patient health information and company material, that they're not going to become the power of attorney for any patient. We have that happen sometimes. They're not allowed to do that. That they agree that if they leave your agency, they're going to return information, and that if they destroy information on a patient, they're going to do it in accordance with your HIPAA manual and regulations. This is the field practice statement that they sign, and again, this just has them sign that they agree to do certain ways and present themselves to patients, and that they're going to follow your dress code, and they're not going to, you know, make personal phone calls and, you know, do things that you don't want them to do in the front of a patient or around a patient. The confidential statement, again, talks that they agree that they're going to ensure confidentiality of all your patient information, and that they know that they need to be careful about what they write and verbalize. And this particularly becomes important now that we see a lot of employees using Facebook to possibly post patient information and pictures. And so again, this protects you when they sign this statement. There's also a corporate compliance policy that they sign and they acknowledge. And this is basically talks about fraud and abuse of patients and billing, fraudulent billing and making fraudulent notes and so forth. Policies and procedure statement just says that they have read and they understand that they are responsible to follow the policies and procedures, specifically on some very specific policies that that Medicare and CHAP wants to know that they've agreed to that they've read and that they're going to follow through with those. Protective equipment statement, this is going to be for all of your employees that are touching patients. And again, it just says that they've been informed about the fact that there's personal protective equipment kits in the office that they can have access to if they feel like they're being exposed to a patient that's got TB or a communicable disease. The exit interview you're going to utilize anytime an employee should leave your employment. Again, you want to, part of one of the standards is that the agency will manage employee turnover and identify reasons why employees are leaving your agency. And we do this in the form of the exit interview. If the employee refuses the exit interview, then just document on there that they refused and go ahead and put it in the personnel file. If you're not able to locate them for whatever reason, again, anytime that you can't complete this exit interview for whatever reason, make sure you just document on there and put it into your employee file. Section 6 is the payroll forms, W-4, 1099, and any miscellaneous payroll forms. This might be a sample check if you're going to do direct deposit. This could also be if the employee's having some wages garnished and there's some IRS documents or something that needs to be in there. So that's what would be in that section there. The next slides talk about your confidential folder that we spoke on earlier. This would be all of your physical and or your criminal background checks. It would also be if your employee had a workers' comp injury and had to receive treatment, say for a needle stick or a fall or something of that nature, that would be in here as well. Again, you are going to want to separate this from the rest of your personnel file. It should be in an envelope that's sealed and is marked confidential with the employee's name on it. Like a brown envelope is sufficient for that. One of the things that the employees will sign is a free of communicable, or will have signed that will present to you before they start work, is a statement of good health or free of communicable diseases. Now, this can be done on this form, or it can be done on a prescription pad, or it can be done on any other form, again, that has the statement on there that the patient or the employee is free of communicables and appears to be in good health to be able to work. The exam needs to have been performed within the last 6 months. It can be by a physician, or it can be done by another licensed healthcare professional. And by that we mean a nurse practitioner, a PA, someone of that, but not an RN. It can't be signed by a regular RN. Again, this is for any of your employees that touch patients. And again, it's a one-time thing that's done unless there's reason to believe that the employee is infectious or is needing to be examined by a healthcare professional to continue working for you. As far as TB testing, chest x-ray, and the TB questionnaire, we get a lot of questions about this. We basically follow the CDC guidelines, and we identify you because in your policies we say that you're not going to accept active TB patients. So we put you in a low to moderate risk, which would mean that at least every year you're going to have any of your employees that have patient contact is going to have a TB test done. If they can't take a TB test, then at least every 5 years they need to have a chest x-ray. And on the years they don't have the chest x-ray, they need to complete the TB questionnaire. Part of that questionnaire will be also that your director of nurses or your director of clinical operations or should be reviewing that questionnaire to make sure that that employee is not demonstrating potential signs of active TB or some other type of infectious process. So basically your policy for TB testing is in two places. It's actually in your personnel files manual, and then it's also in your infection control. And we want to, whenever you hire a new employee, we want them to show proof that they've had a negative TB test within the last 12 months. If they have, then they only need a one-step TB. If they have not, if they can't show you proof that they've had any TB testing within the last 12 months, then they will need to complete a two-step process. And then after that, yearly thereafter, as long as they stay employed with you, then they only have to submit a one-step TB. Same thing goes with if they're going to have a blood testing, an IGRA, then that is anything they can produce that if it's negative within the last 12 months, and then you're going to repeat that every 12 months. So that's basically that on the TB. Like I said, we get a lot of questions on that. So if you need to ask questions on that, feel free to call us and, we can talk to you about that. And again, the CDC guidelines are going to be a lot more stringent than what's required more than likely by your state. But because you're being accredited by CHAP, the expectation is that you're going to follow the higher standard, which is the CDC. Immunizations are very state specific. There are states that require immunizations. So again, you're going to need to be aware of what those immunizations are and how you need to show proof that they've had the vaccination and or they've had a positive titer. So again, if you're required in your state to have immunizations, we would have that listed in your personnel policies. All of your employees that see patients, touch patients, are required to have in their personnel file either an acceptance or a decline of the hepatitis B vaccine. Under OSHA, because we are a healthcare industry, the employer, being yourself, the agency, is required to offer all direct care employees a hepatitis B vaccine at your cost. The employees can decline it. A lot of employees have already had it. If they accept it, then you need to make sure that you've set up that process for them to receive that vaccination series. It's actually a 3-part, and then once they finish that 3rd injection, then they have a titer done to make sure they converted. If the employee declines the vaccination, then that's fine, but know that they can come back at any time during their employment and say, I've changed my mind, I want to get the vaccine, and you still have to honor that request. If the employee tells you that they're declining because they've had the vaccine, then they need to show you proof that they've actually had the vaccination series and they've had a titer. If they can't show that and provide that to be put in their personnel file, just have them decline the vaccine. So again, if they accept the series, it needs to be started within 10 days of them saying they want to get the vaccine. Now, I get a lot of questions because agencies have a lot of employees that are per diems, and they're concerned about starting the vaccine or paying for the vaccine because it is pretty pricey, and then them leaving their employment. What I would say on those per diem employees is that, let the employee know that, yes, once they've gotten all of the injections and they've done the titer, then they can submit invoices to you and you will reimburse them for the hepatitis B. So you're still meeting the part of the law that requires you to pay for the vaccine, but you're kind of covering yourself too, because more than likely if it's a per diem, they're not going to finish the series and they're probably not going to stay with you long enough to get those titers and those finished. So it kind of protects you. All of your employees need to have a criminal background check. They also will sign what we call an attestation. The attestation or affidavit for each state is very different. So each state has their own attestation that's signed, and we provide that in your policies, and we also provide it in your personnel files on your thumb drive. All of your employees have to sign this, and by signing that attestation, it allows the agency to complete the check. You need to be familiar with what your requirements are in your state of whether or not you can begin orientation before you get that background check back. Most states will allow orientation, but no direct patient care or no direct independent patient care, meaning you could go out on orientation with another employee, but that they couldn't go out and see patients by themselves before you got that back. The other thing, make sure that when you do get that background check back into the office, that it's being reviewed either by the administrator or the DON, and it's not being just filed in the patient or the employee file. A lot of times we'll see those filed, and there'll be something in there that will disqualify them from seeing patients, and nobody's ever looked at it. They've just filed it. So be very careful about that. The other thing is be aware of any expiring dates on those criminal background checks. Every state's a little bit different as to how often those need to be repeated. So you need to be very familiar with that policy. It's entitled Criminal Background Checks, and then it's in your personnel policies. So there's also other documentations that you may have in that file that can include medical notes, work limitations, workers' compensation. Any of those things would also be in that confidential folder like we talked about before. So in conclusion, to talk about the personnel file, understand the sections of the personnel file. There's 3 basic ones: the main personnel file, the medical section, or what we refer to also as the confidential file, and then the file that you're going to keep all the I-9s in. Be very consistent on how you set up your files. There's nothing more frustrating for a surveyor to get files that aren't coordinated and filed correctly, and everything's thrown in a file together, and they have to search for the information. That will more than likely result in a deficiency for you. So you want to make it very consistent and easy for them to look at and find things in that file. We also recommend that you do audits on your files, particularly once you know that the survey is getting close, that you need to audit all of those files, and we provide you with a personnel audit tool so that you can easily do that and make sure everything's current and present in those files. The files are all confidentially maintained, and the surveyor, and we'll do the same thing when we do your site visit. We want to make sure that are all either in a locked cabinet or behind a locked door with limited access to those. The personnel performance, make sure that all of those personnel evaluations are done timely. The competencies are done timely. And again, by you auditing them, you'll make sure that you're staying in compliance and that you won't get deficiencies on your personnel files. I mean, really, your personnel files should be one of the areas during the survey that, we would hope that you wouldn't have any deficiencies on because it's really easy to keep them. So that concludes our webinar today. I hope that you guys found that helpful. And hopefully when we come to do your site visit, you've able to put all your personnel files together so that we can look through them very quickly with you and make sure that you're compliant and be able to answer any questions that you have, regarding your personnel files. Take care, and we look forward to seeing you on your site visit.